Amos, you and Marcus and I agree. We believe in medicine and science, and one thing that really bothers me, amongst the progressive community right now is too much attention's being paid to pseudoscience, and the garbage that's there. There are a number of individuals that are claiming that came from a lab, and all sorts of weird things, and using of all things patent applications to try to prove something. Now, if you've ever filed for a patent, and I have, by the way, and I've also been granted one, patents are not an instrument of science. They are a legal device, and they are flawed as shit. So you're not going to prove anything by going to patent applications. And I also know that, basically the patent I have, I was working for a guy, and I mentioned this idea I had to the owner of the company I was working for, and he thought it was great. And he ran out and got a patent on it and gave me my $10 for it. And, it exposed me to the whole game, and industries are always patenting everything. And here I'm just telling you that there's a cadre of fools. Well, they're not fools, but they're getting a lot of disciples who, it's horrible. It's pseudoscience. It's I think at one time. Yeah, go ahead, Amos. You go ahead and interrupt.
No, I agree. I was watching the other day. I was watching Jimmy Dore going after Faucci, and I don't think that he understands what he's talking about. The whole idea of Rand Paul going after him was to like somehow implicate that that they had to do with the creation of this virus, which is completely unfounded and ridiculous claim. But however, he just. And he accuses Fauci for doing a play of words. In fact, it's the opposite. But I don't know if he's that clueless or if he's promoting it for a political purpose. I just really don't understand that. I don't know why. It doesn't help anything either way. It doesn't make the virus less threatening or less dangerous, or the need to take vaccines any less important. So I really don't know. I don't know why they're getting locked into this false narrative, and it's just frankly very disappointing.
Oh, totally. Yeah, we should definitely play this then, because this is the message I want people to see. But yeah, it's terrible that people are so misinformed about things, and they're not understanding that there are people who are taking advantage of this and for their own reasons.
Right.
Yeah, when I saw this, I sent it to my wife.
What we've noticed is that the Delta variant is about 1,000 times higher amount of virus in people's nose than the initial variant that we saw back in February and March of 2020. And so that means there's a lot more virus being spread out, and that also means that it is much more easily transmitted. If everybody had been vaccinated, this may have been totally averted, but given the fact that it has not been such, what we have to do is start putting up the same barriers that helped us cut things down, so-called non-pharmacologic interventions for addressing COVID transmission. To be honest, I never stopped wearing a mask in a grocery store. Because I've never trusted that everybody not masked is truly vaccinated. And so I believe that we're back to, if you go grocery shopping, you got to mask up. If you're outdoors, you probably still can get away without masking. But anything indoors where you're not within your own little bubble of people who are vaccinated and are part of your family, you have to mask up. I think for the general public, because most people are not fit tested, Their N95s don't necessarily work like N95s anyhow. And I think for the general public, unless you're going to be in very intense circumstances, wearing a surgical mask should be more than adequate, or wearing a good cloth mask that fits well, particularly cloth masks that actually have these filters on the inside of them. Every time the virus multiplies, it mutates. And every time it mutates, if the mutation is beneficial to the virus, then it gets carried forward. So Delta isn't going to be the last variant. And that is in large part on the unvaccinated community, who are helping to generate all these variants, which will make it more and more difficult to control the pandemic. People keep saying, I don't know whether it's safe or not. There are 150 million people who have been vaccinated. The number of severe illness signals are minimal. This is a safe vaccine, and it works. We felt like we were close to the end, and now we're right back in the soup again. It's maddening. I think the one take-home message is, if anybody ever wants this pandemic to end, they got to get vaccinated. And if they have questions, there are plenty of people who can answer questions. This is the way out of the pandemic. We have to get the population immune, right? You know, when people talked about getting herd immunity with the older strains of virus, maybe 70% would have been good enough. But now we're looking at a strain that's much more transmissible, and we have to get up into the 80s, maybe as high as 90% to really get herd immunity. For all the people who don't like wearing masks and who find all this intervention annoying, get a vaccine. That's the way you get done with all this stuff.
Yeah. You know, 150, he said in the tape there, 150 million people have been vaccinated. You know, and there's this fool named Robert Malone out about right now, and he's pushing the notion that, you know, vaccines are very, very dangerous to a certain age group of young men and so on. And, you know, so I found out about him, and I did a little research, and I quickly found out he's full of shit, because the fact is the cases of this heart condition that's supposedly showing up by these vaccinations is lost in the noise. We're talking about 5 cases in a million. And you can't even, you know, and I was looking real hard, because one thing I wanted to find out was, okay, if it's 5 cases in a million now, what was it before? Was it 4, 5, 7, 3, 1? Could not find that answer. You know, and that's really interesting that, you know, they put out the info that, you know, they want you to know, and they hide the rest. And the same people accuse, you know, our medical professionals of withholding data, which is the most ridiculous idea. I can't even imagine that. A medical professional, you know, withholding research data from another medical professional. Yeah, you know, in terms of NDAs, and you work for this company and that company, but basically, no, you're talking about men of science who are working together, and you know, if you don't show me mine, I won't show me you. You know, it's a reciprocal thing, and you know, when people say something like that, that just shows they're taking advantage of people who don't know how the world works. Yeah, you know, I have to say it.
Yeah, I believe we try to do our best here on the show, giving you predictions and information as soon as we kind of read it in the tea leaves from findings in Israel and so forth, and we did predict that we would be getting back to masking and to all these good things. Unfortunately, and there's more and more information coming that suggests that 20, for example, information from Israel pointing out that 20% of those who are vaccinated and do get the breakthrough COVID, 20% of those people actually get long-term effects. So even if you're not going to be hospitalized, which is less likely, you're like 91%, I believe, protected from being hospitalized or suffering death from the Delta variant. If you're vaccinated, you still could get long-term effect, and that includes things like myocarditis and breathing issues and all kinds of nice treats. So there's still all the reason to be masked and to take precautions and start rethinking our newfound freedom, so to speak. I think we're not there yet. We have to rethink all of this. The sad part of it is that the new variant Delta and some of the other variants, and probably I and others expect that future variants are going to focus much more on younger age of people. So far, the COVID has spared children, but that is a hugely untapped population for transmission of the disease. So naturally, it would stand to reason that is going to be where the virus is mutates next. So we will have a huge number of child victims that are going to be suffering this as opposed to up to now. So,
yeah, well, the thing is, nobody knows. Nobody knows what's going to happen. And I've known this I've known that nobody knows all along. And viruses mutate. The particular mutation that occurred in England was a more deadly virus, but it wasn't as contagious. So that one has been replaced by the Delta, which is fortunately no more deadly than the Alpha, but much more contagious, and that's why it's around. And in this tape we just watched, one phrase I sticks in my head is non-pharmacological interventions. That is the way I believe things should have been done all along. I wanted things done so that vaccines were a backup, that they would only be used if absolutely necessary, which is our case, by the way. And that human reason and people behaving as adults instead of screaming about freedom, which only shows me they don't even understand what freedom is, basically murdering people. If you're passing on a disease that maybe made you sick, and you pass it on and made somebody else sick, and then they pass it on and killed somebody, guess what? You are in that chain. And so sleep with that. You who felt it was an infringement to put a piece of cloth on your damn face, that you can actually be walking down the street. If you catch COVID and later on you might be fine, but you may have passed it on and killed somebody, and I'm saying it. I haven't heard anybody else say it. And I think it's about time it gets said that, ignorance is murdering people. And we have a number of people, they put on suits, they wear bow ties, they flash some academic credentials, which may or may not relate to the subject at hand, and basically think that, what they say is their right to say it, and I'll rant a little bit about that too. You see, what's going on right now in a lot of the, say, leftish liberal community is that, these people, there's censorship going on, and I've experienced censorship. I have my own website. I know that there's censorship going on. I actually have known it for a few years, but, I don't think what's going on with COVID is censorship. I'm going to put this outrageous statement. I know I'm going to get a lot of people mad at me right now by saying this, but if you scream fire in a crowded theater, guess what? That's not free speech. You are endangering people. You don't have to the right to vibrate the molecules of air in the room when you are endangering people. And what's going now in what people are calling censorship is very deliberate. It's targeted. It's targeted against specific ignorance that can be identified. It's not like, oh, I'm going to censor you or I'm going to censor you. You know, one thing, a number of channels, you know, have had shows pulled on YouTube, and we've had our shows pulled too. And I'm no fan of what YouTube does at all. But, you know, there are a number of people who've been complaining about shows getting pulled on their show this week, and there's this rampant censorship, and we can't say what we want to say. Well, guess what? You kind of forgot that you put on that tape with that guy with the bow tie, which I did not do, by the way, because I want the show to be seen, you know. And if I did put on that the show with the guy with the bow tie, I would expect correctly that this show, you know, be suppressed, because this is misinformation. This is taking advantage of ignorance. It's perpetuating ignorance, and it's perpetuating pain and suffering, you know, and we got to get past this. We got to get organized and get past this pandemic. We have to solve all our other problems. You know, we're getting stuck, and we're getting stuck by people, you know. Since I'm ranting about this, I'll tell you, months ago, I had a problem with Brett Weinstein. Now, I happen to be, or was, kind of still am in a way, a Brett Weinstein fan. I didn't like what happened to him at Evergreen, college and all that. But, you know, at the beginning of the pandemic, he has some, credentials, doing some research as a student or something with something to do with the virus. Anyway, so he comes out with this, that it came from a lab thing. And, I think what he did was really irresponsible. You're putting out this stuff without any scientific background, just because you think it may have happened this way, because you have a certain background that suggests it might have happened that way, and putting it out there basically as fact. Because, a few years ago, I kind of changed an attitude. And my attitude had been that basically, if you had an opinion, you should just get it out there and say it, and just, get it out there, right? And then I had a sad realization that, sometimes people put things out that the vast majority of the public really can't understand, or they take it with a certain bias. And so whatever clever, things I might see, they're not seen, and an example of there's a particular individual that, basically is spreading the rumor that we're all going to cook next year. Every year it's next year, the climate change is going to, burn us all up. And if you had been listening to him, believed him, we should have been burned about 10 years ago. But, he's still out there. He's still putting out his message. He's still getting followers. But, and at one time, I was kind of a fan of him in the sense that, hey, and I went and saw him in person. You're putting out a message. You're making people think. That's where I was coming from. Then I realized you're putting out a message and people aren't thinking. And it went from, I'm okay with what you do, to don't do it. Don't do it anymore. So,
Right. As to that claim of the lab leak, there's really at this point, there's no evidence, there's no conclusionary data. Most experts believe it would not have been possible looking at the genetic codes. But it's not completely impossible that happened. If it happened, it's not something that was intentional. Apparently, if it did happen, but there's really no evidence. There's no conclusion as to where that virus came from. There's a possibility it came from a previous mine expedition where they retracted some viruses, and there was a virus, one of which varieties resembled to some degree the one that we had initially. I don't know. We can cover that maybe in the future, but it certainly doesn't change anything. So
yeah, well, I'll put out one perspective I have on that quickly, and that is I look at things, those kind of questions, from a mathematical point of view as well. And one thing I see is a lot of these things are only looked at with a black and white thing. But I actually look at, okay, there are a finite number of labs. The ways it can get into the environment are kind of, there are a lot of them, but they're smaller than the number of caves in the world containing bats. You know, the real world is, the natural world is interacting with us continually and never stops. And just from a mathematical point of view, the odds of it coming from a lab versus, you know, it changing a protein and suddenly becoming very infectious in humans and a bat sneeze near us, you know, to me, I look, like I say, I look at the math, and I don't see that the lab makes much sense. The lab, you know.
Yeah, it's still an open question as far as absolute confirmation is concerned, for or against. But either way, it doesn't change. Like I said, it doesn't change anything.
That's right, it doesn't, and I agree. It is an open question, and but one thing that's aggravated me is all this talk kind of has taken away the point off of what we should be doing, which is wearing a mask, you know, acting responsibly, and getting this thing behind us.
Yep. So we agree about that. Regarding the march, I just wanted to bring up, going back to the march. There's people who've been complaining recently that the progressive demonstrations were in front of, so to speak, progressive politicians' offices, and it totally does make sense. It's not directed at Manchin, although I wouldn't mind protesting against him either. But it does make sense to protest in front of people who made a promise and got into office based on these promises, and whose constituency is supporting those things, rather than in front of Manchin, whose constituency is not particularly concerned about healthcare or whatever we may be promoting. So it's not it's totally justified in my view to do so and mount the pressure. And I'm concerned looking at for example AOC's position. I'm very willing to give people the benefit of the doubt, especially with politicians, with all the knowledge that they have to maneuver around and strategize, and we may not know all the details. However, these people have not even done as much as tweet in favor or spoken at those rallies, and that's kind of disheartening. And it goes to a bigger issue of trust, and once you lose the confidence of your constituents, it's very, very difficult to regain it. I don't think it's mostly it's not reversible. So if they don't notice that they're going the wrong way with that, and losing support along the way, they're going to find themselves out of office. Maybe somebody more centrist and conservative is going to take their place, which would be a shame. However, I don't think they should feel confident about their position at all, and they should consider that before they ignore what's going on on the ground.
Well, yeah, Congresswoman Jayapal, sent a message that was read on the stage at the Seattle march, and that was really nice that she sent a statement. It would have been much nicer if she had been there. Right. And Cori Bush did the same thing in New York.
Yes, she came.
Same story.
And she participated in she didn't speak at the rally, but she was present at the DC rally, I believe.
Congresswoman Jayapal, I recall it actually came out. There was a pre-recorded statement, and she apologized for not being able to be there.
Right.
Having whatever Since we don't know what she was doing, maybe it was more important. We can't say, but
Right.
we do know that she wasn't there.
Right.